Hello, FBC Jasper family of faith. We are glad to provide this video for you. We have Dr. Carl McCurdy here. Dr. McCurdy has served Jasper for 37 years, and we are so grateful to have him in our congregation and in our family of faith. And he is joining us tonight to give us some more information and answer some questions about the coronavirus. So I'll let him get started for us.
Thank you. Well, this is a topic of discussion, and it's the first thing on everybody's mind. Every morning when I wake up, the first thing I do is reach for my phone to find out the day's information. So I've got a little outline here, and I want to start with telling you a couple of warnings. The first warning is that I'm an establishment doctor, and that means that I grew up in traditional medical practice. I was trained. I'm a part of the medical system, and being part of the system, I believe that working together in the system is our best way to approach this problem. In other words, I don't have any conspiracy theories, and I don't know of any particular cowboy doctor that's out there that's got the answer. So I do believe in the system. The second thing is that today's date is 3/18. Today is March 18th. We're gathering new data every day. The rules, the protocols, the recommendations are changing every day, and I may have a chance to mention some of those changes. Remember that this virus did not exist in human beings 90 days ago. So in a lot of ways, we're feeling our way along. We're making some mistakes, and we're trying to correct those. The other warning is watch where you get your information. We have a Piedmont Command Center that gives us updates more than once a day, at least once a day. Also, I go to the Georgia Department of Public Health website. In particular, I like the Johns Hopkins website, and I just checked the Johns Hopkins website before coming on. And worldwide, we now have 214,894 positive cases, 8,732 deaths worldwide. In the United States, 7,769 positives, 118 deaths, and in Georgia, 199 positives as of this afternoon, and 3 deaths. So we can get current information. AAFP, the American Academy of Family Physicians, AAFP.org, and GAFP, the Georgia Academy of Family Physicians.org. I also trust WebMD and the Harvard websites. However, since January 1st, there have been over 4,000 websites set up related. So first of all, watch where you get your information. So the question, what is it? The coronavirus in 2019, it's also called the novel coronavirus. Novel simply means new. The new coronavirus was a respiratory illness that spreads easily from person to person. It spreads usually within 6 feet, usually by respiratory droplets with the nose and eyes. More about some of this later. The average time from infection to symptoms is about 5 days, with a range of 2 to 14 days. Also, once you become infected, so in those respects, it's very similar to influenza. Now, once you get infected, lining of the mucous membrane of the respiratory system down through the nose, the mouth, the larynx, the voice box, and to the bronchi or bronchial tubes into the lungs. Mild symptoms are what you have to start with: dry cough, shortness of breath, fever, headache, possible muscle pain, and tiredness. Now, 80% of the people who get infected have only mild to moderate symptoms. In severe or critical cases, the infection goes ahead and penetrates down further into the lungs. The body's response to this infection is to send white blood cells and immune chemicals to the area. This causes the cells to swell up, to have edema, and also produces fluid that gets in the airway. When this tissue swells and the fluids accumulate in the air sacs where oxygen exchange takes place, that's the definition of pneumonia, is fluid in the air exchange spaces. And when it gets bad enough, a patient might have to go on artificial ventilation. It may cause respiratory failure or even death. But let me stress that this outcome, this severe outcome, is uncommon for the vast majority of patients that are infected with this virus. The higher risk of those complications is for older patients, older than 70, and those with chronic medical conditions or compromised immune systems. So, first question, what can you do to protect yourself? These are things that you've already heard, but repetition is exactly what we need. Number one, stay home. Avoid group activities. No face-to-face work meetings. No church, unfortunately. Cancel your travel plans. Go shopping at off hours. Basically, limiting your contacts with people. Number two, wash your hands and wash them again. Wash your hands not just the usual times, before and after meals and before and after the bathroom, but also start thinking about washing your hands or using hand sanitizer before going into a new building, before going into a store, after coming out of a store, after coming out of a building or office or classroom. And everybody says that we kind of laugh about it. Don't pick your nose. Don't put your fingers near your mouth or your lips or your eyes, because that's an entry for the virus into your respiratory system. Think about sanitizing the objects that you and other people touch. Your phone, doorknobs, countertops, commonly used keyboards, and that sort of thing. And then we're going to keep hearing this word. You're going to practice social distancing, because your risk of contracting the infection from a contact depends on how close you are to the infected person, the amount of time that you spend with an infected person, and whether or not the infected person is coughing, sneezing, etc. So I mentioned chronic health conditions. What are chronic health conditions? Chronic health conditions include heart disease, cancer, diabetes, things that can compromise the immune system, and it also includes the elderly, especially people over 80. So people with chronic health conditions should sharply reduce their exposure. Avoid travel and avoid group events. Smokers are included in this group. Smoking makes your lungs more vulnerable. Smokers should quit now. It's amazing what a couple of weeks of quitting smoking could do to help your respiratory system. Diabetes. Diabetics should work right away to improve sugar control, because out of control diabetes can lead to a more severe course of the disease. Asthma and emphysema patients should talk with their doctors about their plans, what they should do if they get an infection, even a mild infection. With this spring weather coming up, we're going to see some allergies and that sort of thing, and they should be in contact with their doctors about their own plans. If you think about patients with heart disease, an illness like this causes increased stress. And one of the questions that somebody had for me today was, why don't we hear more about death from influenza? And one of the things that we see is that, in fact, influenza, as COVID-19 does also, puts a lot of stress on the heart. So we may have a heart patient who gets influenza, has to come in the hospital, and then dies in the hospital of a heart attack. The death certificate would read heart attack. It doesn't necessarily read influenza. Patients with immune compromise, such as cancer, chemotherapy, radiation therapy, patients with lupus, with rheumatoid arthritis, and the autoimmune diseases, transplant patients, these are all included in the patients who have immune compromise and should sharply reduce their exposure, avoid travel and group events. So one thing I wanted to mention is the different approach that you take when it's an individual patient and when it's a population that you're concerned about. So with the individual patient, we are concerned about, what can we do to help the patient? How can we treat this patient? And we're very concerned and narrowly focused on the patient. But our public health officials and our public health doctors are concerned about the entire population. So there's a little bit of a different approach when you're concerned about the entire population. Doctors are sometimes called on to keep both considerations in mind when they're making decisions. And that brings up the difference between an epidemic and a pandemic. So an epidemic the definition of an epidemic is the outbreak of a disease in a small group, a small group of people or a small community. And a pandemic is the same thing, except it's over a widespread area, such as a state or a country. In controlling an epidemic, controlling an epidemic is different from treating an individual patient. With an individual patient, I want to do testing, I want to know what's going on, I want to be able to support that patient with medical treatments, hopefully something that might be curative. With an epidemic, the main thought is to prevent spread in the population. And there's a couple of models that have been under discussion and have been used to control epidemics in general, and this epidemic in particular. One model of control is the extreme social distancing that we're talking about. It includes isolation and quarantine. And many countries have adopted that, especially if they're a little bit behind the 8 ball and they see an epidemic getting out of hand. They immediately come back with the first tool that they have at their command, and that is the social distancing. We've seen countries do that. It can get extreme in some of the other countries. We look to be a little bit fortunate simply because we're in a rural area and we're not densely populated. We're not in a city with people living closely together. But we do see in our nursing homes and assisted livings, we do see some small models of very dense population where the social distancing is very difficult to achieve, as it is in cities like New York and some of the other cities. The other model, and the model that I hope we get to as soon as possible, you might call ubiquitous testing. And this would be doing a lot of testing, finding out who is positive for the virus, and then having those people who are positive isolate themselves or quarantine themselves, so the people who are not affected can have a little bit more of a normal life. Because if you go the extreme route of social distancing with isolation, with travel restrictions, we've already seen what it does to the economy. Also, there's a lot of panic and there's a lot of unknown in that sort of model. So as soon as we can, we want to get to testing. You've seen it on TV in the news conferences. I can tell you that as of today, In Georgia, we've got the testing capability of about 200 tests per day. Hopefully by the end of the week, we'll have the ability, as soon as possible, to have about 400 tests per day. And just to mention to you some of the ways the rules have changed is that that up until the last couple of days in Georgia, you would only be able to get a test if you were sick enough to be in the hospital and sick enough to be in the ICU. People who were not sick would be told to go home and self-isolate. People who were not sick enough to be in the ICU. We are slowly ramping up the testing capability and should within a brief time be able to get past this extreme isolation that we're and distancing that we're trying to accomplish now. Because there is some danger from isolation, even though there's protection from social distancing. We know that, for example, prisoners in solitary confinement, we see that they begin to become more anxious, much more depressed. We know from studies in older people that social isolation comes back and gives as much impact in their lives as as a medical problem, like one of the medical complications. So there's a big question then: if you're going to increase loneliness, depression, and anxiety with isolation, with social distancing, how are we going to help combat that? And I was very glad to hear Anna do a blurb about a plan within our church family to help those who are more isolated, to help connect them. I'll remind you to use the telephone. There's no substitute to talking on the telephone. Young people love text messaging, but I'd rather talk to my mother on the phone than text message her. There is a lot of good and a lot of bad about social media. There are people who love the different social media. I can tell you though that that it is possible to get in a little bit of a silo on social media and to increase your anxiety from the things that you read and the things that you hear on social media. I recommend people limiting their bad news to just a short period of time a day, and once you do that, then spend the rest of the day reading, watching TV, having fun. I don't think anybody has recommended that we limit walking so far. And the good news is that it looks like our pets are not involved in this virus. So you can always have your pets as companion. But I do recommend that people limit their bad news daily. Anna has let me give this talk without any pre-instructions or without any vetting. So I'm going to take a couple of minutes to make a personal note here. It turns out that natural disasters frequently bring people together. Earthquakes, hurricanes, the tornado in Jasper almost 20 years ago. But epidemics in history actually cause people to grow apart. If we are not careful, epidemics kill compassion. If you go back to examples, and one of the very few things I remember from Dr. Austin's class at Shorter College a long time ago, from the Decameron by Boccaccio, he talked about the plague in Florence in the 1300s, and people, they were basically in it all for themselves. They didn't think about other people. Daniel Defoe wrote in the 1600s about a London epidemic. He wrote, and I quote, "The danger of immediate death to ourselves took away all bonds of love, all concerns for one another." We feel helpless and out of control in epidemics. Epidemics hit the poor the harder than it hits the more well-to-do. Epidemics inflame class divisions. Even the biggest epidemic that we've had in America in the past, the 1918 flu epidemic, shows examples of a lack of volunteers many times, lack of volunteers and a lack of caring for those who were less fortunate. And when you think about it, we've had people in our acquaintance who've lived through that epidemic of 1918. That epidemic killed over 750,000 of Americans, over 750,000 Americans. But nobody wrote very many books about it, and nobody wrote very many plays about it. And one of the thoughts is that the people who lived through it, in some cases, were ashamed that they couldn't help other people more than they did. We have an opportunity. We have an opportunity to demonstrate courage and compassion. This is more than just about ourselves. So I applaud you, Anna, and I hope that everybody searches for ways to help, not foolishly placing ourselves in danger, but by not forgetting or leaving behind those of us who need our help materially and emotionally and spiritually. And in closing my prepared remarks, I want to mention some of the good things that are going to come of this. We've talked about a lot of bad news, but there should be some good things that come of this. One thing right now, with social distancing and hand washing, we're going to stop this season's flu in its tracks, just like that. After seeing dozens and dozens of influenza patients over the winter, I'm sure that's going to stop right away. We'll most likely reduce our consumption and our carbon footprint. People are telecommuting more. We're going to be flying less. Our children are going to understand a little bit more where our stuff comes from. It doesn't just come from the grocery store. So they're going to understand a little bit more where our stuff comes from. And if we can get through this without those that are less fortunate being totally left behind, it's possible that we may actually change our medical system in some ways that can help everybody. That remains to be seen, but I have a belief that Americans can rise to the occasion, and the cliche is that necessity is the mother of invention, and we certainly have a lot of good people and smart people working on not just the immediate plan, but plans for the future. So that's my heartfelt wish that we can get some lasting good from this, in addition to taking care of ourselves in the short term. So let me sum up by saying, right now we are in a period where we really do need to be practicing social distancing. Wash your hands. Don't touch your face. If you are sick, talk to the doctor. Call your doctor's office. Call one of the hotline numbers. If you are not sick enough to be in the hospital, right at this time, we are not going to have tests for everybody as an outpatient. We hope to have those soon. And when we can, we'll be testing a lot more people so that we'll know who's positive, and they can be more intensely isolated, and we can protect the people who have not been exposed. I think I'm open to questions, Anna, if you have any, or if you can think of any.
Well, Dr. McCurdy, you've covered every single one of the questions we have so far. Thank you so much for everything and offering this information. to us because, like you've said, there are many sources out there and it can be hard to figure out which ones are reliable. So we really appreciate that. And thank you to our family of faith for watching this and staying informed. And if you need anything, please call the church office or send us an email. And again, thank you, Dr. McCurdy, for joining us.
Thank you, Anna.
We love you all, and we hope to be connected with you soon.